Hi, I am Dr Kailas Mirche. I am a consultant neurologist at Citizens Hospital, Nallagandla. Today we will be discussing something about brain stroke. What is brain stroke? Brain stroke happens because of decreased blood supply to the brain because of the clot, or it can happen because of bleeding inside the brain. So what are the commonest causes of brain stroke? The most common cause is uncontrolled hypertension, that is uncontrolled blood pressure. The second commonest cause being diabetes mellitus. Other than this, excessive alcohol intake, cigarette smoking, sedentary lifestyle, and hypercholesterolemia. So along with this, if patients have any other cardiac issues and some genetic disorders are also causes for stroke in young patients. So what is the incidence of stroke in India? So there are almost 2 lakh strokes per year in India, where brain stroke constitutes second commonest cause of death in India, where every 40 seconds we have one patient with brain stroke and every 4 minutes we have one brain dead patient. So how to identify brain stroke at home? So there is something called as B-FAST acronym. We use it for brain stroke to identify them. B stands for balance. So if the patient is not able to balance themselves, not able to walk, and which is of sudden onset, usually it's a brain stroke. The second comes the I. If the patient has lost sudden vision loss, and then that also constitute a part of stroke. Any deviation of angle of mouth or facial weakness is also a part of brain stroke. Any weakness in the limbs, either inability to move the hand, inability to move the leg, is also a part of brain stroke symptom. And any change in voice or difficulty in speech is also a symptom of brain stroke. If you see any of your relatives or you have these symptoms, you have to rush to the hospital as early as possible, where there is a CT scan facility and a stroke management team. Why? Because every second counts in brain stroke. Each second delay in starting treatment will cause loss of 30,000 neurons inside the brain, and which is irreversible. So how do we identify brain stroke? We already know. And how to diagnose? When you get the patient to the hospital, we clinically examine the patient in emergency and we get a CT scan done to see whether it's a brain clot or bleeding inside the brain. If it is a brain clot, we have a clot bursting agent which can help to open up the clot up to 4.5 hours of stroke onset. And if there is a larger blood vessel occluded, then we have something called as mechanical thrombectomy, where we go inside and we open up the clot, we bring back the clot, which can be done until 18 to 24 hours of stroke onset. So we at Citizens Hospital, we have a comprehensive stroke unit. We have a 24/7 operating ICU team. We have a strokeologist. We have an interventional radiologist and vascular surgeon available 24/7 to take care of stroke patients. So stroke, the most important thing in stroke management is time. Time is brain.